Go ahead with details of all our stories. In line with efforts towards eradicating the scourge of tuberculosis by the year 2030 and achieving global TB targets by the year 2035, the federal government reaffirmed its commitment through partnership with international partners and the private sector to eradicating tuberculosis as a public health issue by the year 2030 and achieving global TB targets. This commitment was restated by the First Lady Senator Reaffirms at the 2024 National TB Conference held in Abuja, themed Public-Private Partnership and Integrated Service Delivery Panacea to End TB in Nigeria. The report. Speaking at the conference, First Lady Senator Reaffirms reiterated the country's dedication to the fight against TB, with focus on public-private partnerships and integrated service delivery to ensure collective commitment.
Despite the challenges, I'm encouraged by the progress that has been made so far. Thanks to the commitment of the Tinubu administration, civil society organizations, healthcare providers, and international partners. Subsequently, we have seen a steady increase in the number of people diagnosed and treated for TB. However, as we celebrate our successes, we must also acknowledge that there is still much work to be done. We cannot afford to be complacent, and I assure you that the federal government remains fully committed to achieving the global TB target by 2030.
The Coordinating Minister of Health and Social Welfare, Professor Mohammed Alipati, in his keynote address, emphasized the need for inclusive rights-based and gender-responsive approaches, while highlighting the private sector's critical role in TB control.
We are resolute in the commitment to eliminate TB in Nigeria. Ending tuberculosis requires an inclusive, rights-based and gender-responsive approach, given the huge burden of tuberculosis on mothers, on women, on grandmothers, and all of our society.
One that leaves no one behind. And I am proud to announce that the Health Ministry, working with stakeholders and development
partners, adopted key strategies relative to the global best practices that we have learned and continue to learn to further accelerate the progress that we have made.
On his part, the Chair, Central Planning Committee of the National TB Conference, Dr. Bertrand Odume, spoke on strategies needed to achieve the TB target.
At the Central Planning Committee level, we set out to achieve 6 objectives, and it's our hope that by the
end of the third year, we'll be able to have met these 6 objectives. One is to enhance knowledge and provide best practices
in TB programming in Nigeria, to provide a platform to foster the design of evidence-based policies for improved TB control in Nigeria, to create an avenue to foster access to research, technologies and innovation in TB control.
The First Lady commissioned new TB lamps procured with funds donated by the Renewed Hope Initiative, marking a significant step forward in enhancing Nigeria's TB response. For ASO Television News, I am Harry C.D.